Have you ever seen a breast cancer patient before? Or do you know any breast cancer patient? And have you noticed that after their surgery, parts of their body, usually maybe their arms, begin to swell after surgery? So today I'm going to be throwing more light and explaining why their body actually swells after their surgery. Hi guys, welcome back to my channel. If this is the first time on my page, thanks for stopping by, and if you're a returning subscriber, thank you for the love and the care. Firstly, this happens, or this swelling that occurs in this patient actually happens for a reason, and the whole mechanism of it, the whole swelling actually takes place because of a system known as the lymphatic system. So before I want to dive into the explanation of it, I want to start from the basis. Firstly, what's cancer? Cancer, in the simplest terms, is just uncontrolled cells which don't want to die, something like that. Like, let me say, cells that don't undergo apoptosis. Apoptosis is known as cell death. So cancer cells are cells that they don't undergo apoptosis. They don't die. Yeah, so they don't carry out not the normal cell death that occurs in the body. So what happens is these cancer cells just grow uncontrollably. Since they cannot die the normal, they don't die at the time in which they have to die. They just keep on growing uncontrollably, and they grow very fast and affect the neighboring cells. The main system that controls this swelling or in these cancer patients, or the cause of this swelling in this cancer patient, is the lymphatic system. What's the lymphatic system? The lymphatic system is a system made up of what they call lymph nodes, which help transport lymph from the body back to the heart, so it can be pumped back into the whole body. And what is lymph? Lymph is just like, in simple terms, let me say, fluid from the blood vessels which has been filtered out into the interstitium of the cell into the interstitium of the cell. Like, I'm going to show a picture to really explain what I mean, but yeah, so lymph is just fluid that has been filtered out from the blood vessel, and when it filters out, it contains ions, it contains bacteria, and it contains viruses. So this lymph, now, for it to be transported back to the body through the heart, or for it to be pumped back to the body through the heart, it has to pass through some small nodules known as lymph nodes, and these lymph nodes help in destroying some of these bacteria, help in destroying some of these foreign agents in the lymph, so that they shouldn't be pumped around the body, which can be dangerous for the body. So also, these lymph nodes are not just important for that. They are also very important in the fact that when these cancer cells begin to replicate, when they replicate, they also affect the lymph nodes. So some of these cancerous cells enter the lymph which is being transported, and it's being transported through these lymphatic vessels into the lymph nodes, and that's why they spread very fast. So due to the fact that when they are spreading, they affect lymph nodes, and these lymph nodes are everywhere. So if they affect the lymph nodes, it's like I don't know, let me see, it's like if I inject you something and you know that it's going to go through your whole system, it's going to go through your blood vessels and everywhere. It's the same thing with these cancerous cells. If they pass and enter your lymph node, it's going to go everywhere. So that's why, as I said, it's very vigorous, it spreads very fast because of these lymph nodes. So what happens then is, during cancer treatment, these lymph nodes have to be taken out, they have to be removed, because, as I said previously, it's because these cancerous cells multiply, enter the lymph nodes, and the lymph nodes now transport them, spread them. So for the doctor to make sure that they've completely remove the cancerous cells in the body, they also have to remove the surrounding lymph vessels. They have to also remove the surrounding lymph nodes to ensure that every cancerous cell is removed. So they can do this with medication, that's chemotherapy. They can do this with radiation, which is radiotherapy. This is all cancer treatments. So when they do this, they also destroy some lymph nodes, and usually with breast cancer, they usually destroy what is known as axillary lymph nodes, because that in our body we have various lymph nodes, and the ones that are around the breast are known as axillary lymph nodes. So when these lymph nodes are destroyed, what happens? It means that that fluid which is normally drained from the blood vessel, which I told you before, and it has to be carried back to the heart. The lymph nodes that are there that do that transportation and help in the destruction of these bacteria which are found in these lymph nodes is no longer there. The function of the lymphatic systems function has all been impaired because some of these lymph nodes has been destroyed. So this excess fluid known as lymph, which was normally supposed to be transported by this lymphatic system back to the heart, begins to accumulate. So for example, if a patient has had left breast cancer, means that the axillary lymph nodes at the left side will be removed, means that the lymphatic system at the left side of this patient will be removed. So what happens is that since that system is not there to help drain this fluid, collect the fluid, the lymph back to the heart, this fluid lymph begins to accumulate and accumulate and accumulate. That's why these patients, you start to see that after some time, after their surgery, after their management, their part of their body, like their right hand, any part that the breast cancer affected, begins to swell up. And apart from the swelling, there are other signs. So the other signs are you have heaviness on that part. It can be the arm, yes. Does the patient also feel tightness? The patient also feel a sense of fullness in that arm, and in most especially swelling. The patient will notice swelling, and swelling must not always come first. The other symptoms that I've named, like the heaviness, the fullness, the tightness, can also come before this swelling. Other risk factors for a patient who had breast cancer and underwent treatment. If a patient is overweight, the person is at risk. So people who are very, in the obese side, that are higher risk. When I was in the hospital, when I was doing my own internship, when I was doing my own practice, I've seen patients, breast cancer patients who come with this swelling limb. It's not easy, and most of the patients who I saw or who I came in contact with were all obese. All of them were obese, and that's one risk factor for them, obesity. Another risk factor to have this lymphedema after their breast cancer treatment is if the limb gets infected. Anything like if the patient gets infected by cellulitis, erysipelas, these are all diseases of the skin. Yes, so if this limb gets infected in any way, whether the bone, the skin, the fascia, if it gets infected, the patient is also at high risk of having lymphedema. The area which was affected, for example, if it was the right breast or the right arm, what they have to do is they have to keep or increase active range of motion in that area. Like they have to be constantly moving the right limb. If it was the right breast that was having the problem, they have to make sure that they constantly move the right arm so as to be able to keep blood flowing, to improve blood supply and circulation around that area, and improve drainage and fluid from that area as well. Because if they leave their arm, they don't mobilize the arm, there is stasis, and there's easy filtration of fluid from these blood vessels out to the interstitium, and increasing the accumulation of fluid and thereby the swelling. Another way to also help reduce the risk factor of developing all this lymphedema is by exercising. So these patients, they also have to undergo a lot of exercise. It's not going to be easy, but they have to undergo this so that the risks of it should be reduced. And also, as I said before, when they injure their hand, when they have injury to the limb, they have a greater risk factor. So they have to do things to prevent them from having injuries to that limb. For example, when they are clearing, they can use gloves to prevent their hand from having blisters. Yes. Okay, yeah, so lymphedema is a real thing, and that's actually the name of the condition, and many people are undergoing it, many people are suffering with it, many people live with it. I just hope that this video has brought more light on it, because I've had a lot of people question it. Even myself, I also wondered why patients always undergo this, and when I got the understanding, I appreciated it more, and I hope you guys also understood it. And if you have any question on it, you can ask me. I'm going to pour more light on it. I try to make this video as simple as possible, reduce the number of medical terms I use so that everybody can understand. Breast cancer is it's a really real big disease. It's a major problem in the world, and I hope everybody who has it finds strength and keeps moving. It's not the end of the world. And if you know anybody undergoing this condition, that lymphadenoma physiotherapist which can help, who can help them treat this condition. It's not permanent. This thing can be treated. That's the good news about it. It can be treated. So if you have anybody with this, suffering from this, let them find treatment. Let them see a doctor if they can be treated. If you watched up to this point, I hope you enjoyed the video, and I hope you saw the video useful. Please help me share, let people know about this. It's a real condition, and see you next time.
If it's your first time on my channel, please hit the red subscribe button below and turn on the notification bell so as not to miss anything. Thank you.